Deputy Shotsky, as he went out before?
Yes.
He's probably one of my favorite deputies, but he has a one China shop. But he's good people. He would never intentionally hurt anybody. Well,
Just reminds me that his window to look out of.
I understand that. That's why I get
Maybe step over.
wherever you're comfortable.
Wherever you're comfortable. It's easy to raise your
Turn and
hand.
face the man.
You swear or affirm to tell the whole truth and nothing but the truth, so help you God. Please take a second. Go over yourself. And you would be so kind as to state your name for the record and spell your name, please.
Stephanie Lechard, STEPHANIELECHARD.
Thank you.
Are you guys hearing her okay? Okay. You may proceed.
Thank you, Mrs. Lechard. I stand back here and I speak abnormally loud to make sure my witnesses speak loud too, okay? So, will you tell the ladies and gentlemen of the jury where you grew up?
I grew up in around Pittsburgh, Pennsylvania.
Where did you go to college?
I first went to Allegheny College, which is in Meadville, Pennsylvania, for a biology degree.
What year did you graduate?
2015.
And what did you do, if anything, education-wise after college?
So then I attended a 21-month master's entry into nursing program at Johns Hopkins School of
Where is that
Nursing,
located?
Baltimore, Maryland.
All right. And what type of training did you receive at Johns Hopkins regarding nursing?
I had like 5 semesters of courses. Is there something specific?
How much practical experience did you get in those 5 semesters?
A little bit with clinicals, but not a lot.
Is there a lot of book learning there?
It is.
All right. So what year did you graduate from Johns Hopkins with a master's in nursing?
2017.
What did you do next?
I took that summer off and took the nursing board, got married, and then started working at the Cleveland Clinic,
What state did you take the nursing board in?
Ohio.
All right. And so you're living in Cleveland now with your husband?
After that, in September, we moved to Cleveland, September of 2017.
And what did you do at Cleveland Clinic?
I worked as a staff nurse on a transplant floor.
What kind of things did you do as a staff nurse on a transplant floor at Cleveland Clinic?
Took care of transplant patients pre and post transplant. So it was all transplants except like heart and lungs would come to the floor.
And how long did you do that for?
About 10 months.
What happened next?
My husband's job was going to transfer to Columbus. He's from this area, so I shadowed with a nurse anesthetist at Mount Carmel West and got to meet the nurse manager there and applied for an open position that they had.
And when was this?
This was in like July of 2018.
How long at this point had you been a nurse, practicing nurse in the state of Ohio?
For like 10 months.
And what job did you apply for, and what job did you get?
I applied for an ICU staff nurse, and that's what position I got.
All right. Was there any particular shift that you either applied for or were assigned to?
I think when I first applied, it said it was like a rotating shift,
What does that mean?
rotating from days to nights.
When did you start? You got the job. Did you start right away?
I started on the floor in about August, I believe,
Of 2018?
of 2018.
And walking in your first day, are you first day at night or first day at day? What's going on?
My orientation was days and nights. The first so many weeks were day shift, and then I switched to night shift.
All right. So prior to August of 2018, when you're going between day and night shift, had you ever actually worked in an ICU, either with your experience at Cleveland Clinic or with your training at Johns Hopkins?
No.
Is this a brand new type of medicine to you?
Yes.
Tell us about the orientation and the training you received during this rotation period.
So for orientation, I was with a nurse. That's kind of where you would learn everything. So different depending on what kind of patient, just the patient status, and what was going on with the patient. That's where I was learning from these other nurses. And I had multiple nurses during orientation.
Okay. How long did this orientation go on?
I want to say it was somewhere between 8, 10 weeks, something like that. It ended at close to the end of October, I believe,
18?
of 2018.
All right. Now, what, if any, were you trained about how medication was retrieved from the Pyxis machine during this orientation at Mount Carmel?
Nothing specific except that it was very common for nurses to override, and that was allowed. Everyone overrode medications to pull it out of the Pyxis.
And you're getting this training from other nurses who are overriding things?
Correct.
You bring that up. Was that different than your prior experience at Cleveland Clinic?
Yes.
How is that different from your prior experience at Cleveland Clinic?
At the Cleveland Clinic, there was very few medications that you were able to override.
Okay. At some point, and we've heard this term, I'm asking if you're familiar with it. Preceptor, preceptee, is that a term you're familiar with?
Yes.
What's a preceptor?
So preceptor is the nurse that's training the preceptee.
All right, so you have a preceptor during this whole time?
Yes.
And this is another nurse showing you how to do things?
Correct.
All right. At some point, do you start working the night shift at the ICU?
Yes.
Do you recall when your first night shift would have been?
I do not.
Do you recall prior to November 13th of 2018, approximately how many shifts you had actually worked in the ICU prior to that date?
Maybe maximum 6 shifts. When I had got off orientation, they were mandating nurses which means they don't need you stay home, and it rotates. And then I was also working on the step down unit, 1 day a week.
All right. So you think maybe 6 shifts total experience, on your own, prior to November of 2018?
Correct.
And do you recall what doctors you would have worked with at night during those approximate 6 shifts?
Dr. Husel or Dr. Hagris.
All right. And you talked about how nurses are the ones training you to work in the ICU. Do the doctors train you or give you explanations?
They will, yeah, they would.
What about Dr. Husel? Is he willing to train you and explain things to you?
Yes, he was. He would sit down with nursing students, nurses. He liked to teach.
So this is where you and your other nurses are learning how to do things at Mount Carmel West.
Injection to leading.
It's transitional, permitted.
Correct, from the staff, the rest of the staff.
What did they teach at Johns Hopkins regarding pharmacology?
I had one course in pharmacology, so it was all drugs in one semester.
All right. Are other nurses and Dr. Husel and other doctors teaching you on the job about pharmacology then?
Correct, yes.
Okay. So, let's take you to the evening of November 13th, 2018. Do you recall that evening?
Yes.
Do you recall having contact with the family and the patient by the name of Sandra Castle?
Yes.
All right. Do you recall what time you got to work that night?
Somewhere probably before 7 o'clock, but my shift started at 7 p.m.
All right. So just looking back in your mind here, walk the ladies and gentlemen of the jury, you walk in at 7 o'clock, what happens?
So normally somewhere between 7 to 7:30 approximately, you'd get report from the previous shift nurse. So you do report with that nurse, so they kind of tell you what has happened, kind of pertinent information.
Okay. What happens next?
And then we went into the patient's room.
Are you referring to Sandra Castle?
Correct.
What, if any, information was relayed to you for purposes of what you did regarding Sandra Castle?
I don't remember all the details of what the previous nurse had told me. I know she told me generally what the patient came in for and how they had palliatively extubated this patient
Do you
in the
recall
afternoon.
when they had- I'm sorry.
In the afternoon.
Okay, so previous that day in the afternoon,
Correct.
do you recall approximately how many hours before she had been, because it's 7 now, and you say the afternoon, do you recall approximately, what was your understanding of how long she had been extubated?
I believe it was like a couple hours.
Okay.
Like,
What, if anything, did this nurse tell you about her condition during this, I think this has been called a huddle? Is that what, am I using the right word there?
Correct.
During this huddle.
can you restate the question again? Sorry.
Regarding her physical condition, was it relayed to you that she's in extreme pain, she's in extreme discomfort at this point during this handoff?
It was relayed to me that she was in pain, that they had ordered 10 milligrams of morphine for her.
And do you recall if that was a 1 dose or a PRN dose?
It was a PRN,
And what does that mean to you?
as needed.
All right, and they had been doing this for several hours at this point?
Correct.
And when you saw your patient, when you first got on, describe her condition to the ladies and gentlemen of the jury.
So when I first got on, I mean, she wasn't like responsive, she wasn't talking, but she was kind of a little stiff, like grimace, like tense, grimacing. That kind of got worse as the night went on. She was labored breathing.
Okay. Would you describe her pain on the morphine that she had been receiving as the most extreme pain she could be in, a 10 out of 10, at that point when you first got on?
Yes.
All right, so what did you do with that?
I mean, I had given her a couple doses of the morphine, but it seemed like as the night went on that it wasn't helping her
Okay.
anymore.
So you continued with this 10 milligrams of morphine every redosing as needed every 15 minutes.
Correct.
And she seems to be getting progressively
Worse,
okay.
more in pain.
Can you describe who's there with her?
When I originally came on shift, she had a lot of family. I don't know all of the family members, but there was a lot of family in the room. And as the night went on, they all said their goodbyes, and it was just a son and a granddaughter that were at the bedside.
Okay. Are you assigned other patients this evening, or are you just with Ms. Castle and her family?
I did have one other patient.
Are you going back and forth?
Yes.
All right. At some point, are you told by the doctor in the ICU about medication?
Which,
At some point, is Dr. Husel called to bedside?
yes.
All right. Describe what's going on at that, what time it happened, why he's called, etc.
So I believe it was somewhere in the 10 o'clock hour.
So this is about 3 hours into your shift.
Yeah, that it was just, didn't seem like the pain medicine was kind of helping her. She was a lot more like rigid, tense, more labored breathing, grimacing. She had a tear running down her face. And after like talking with the son and the granddaughter, who also agreed that they thought that she was in more pain and wanted more pain medicine, I called Dr. Husel.
All right, so the 10 milligrams, based on your observations and the discussions with the family, because they know her best,
Correct.
we need to get something else or something more.
Correct.
You call Dr. Husel, what happens next?
Dr. Husel comes to the bedside, kind of assesses the patient, talks to the family about giving her more medication if they want it, and they agreed.
Okay. So what happens next?
So then Dr. Husel, we step out. He verbally told me the order of the 1,000 micrograms of fentanyl and the 10 of Versed.
Okay, we're going to stop you there. He verbally orders it. What's the other way he could have done this, to your knowledge and your understanding at that time?
I mean, put it in himself.
And, okay, put it in himself, meaning it would go to pharmacy and then you would go get it after that.
At least that the order would have been put in.
All right, so you're given a verbal order. Is this inside the room or outside the room?
Outside.
And you said this was for how much?
1,000 micrograms of fentanyl and 10 of Versed.
Okay, and she had previously, for 3 hours, and then the hours before, been given every 15 minutes 10 milligrams of morphine.
Correct.
Are you familiar, did they teach at Johns Hopkins the concept of titration?
We would like titrate like drips, so I was taught
It was taught.
Of
So
some
could you tell ladies and
titration.
gentlemen of the jury what titration means, under your understanding?
just starting with lower dose, and then if it isn't working, like going up in increments.
Are these big increments or small increments, based on your understanding of how this should be done?
I guess it would depend on the medication. I don't know the specific increments.
But small and then go to bigger. Is that right?
Correct.
All right. So, I'm sorry, you okay? All right, so were you familiar at the time with the equa-analgesic equivalency of morphine to fentanyl?
No.
Are you aware of that now?
Yes.
So she's going from 10 milligrams of morphine to 1,000 micrograms of fentanyl. Do you recall her? I'm transitioning here, Judge.
Let's re-ask.
She was on how much morphine?
10 milligrams,
And then Dr. Husel orders how much fentanyl?
1,000 micrograms.
Do you recall the amount of midazolam, or if she was on any type of benzodiazepine as part of that 10 milligrams of morphine?
I know she had gotten it in the past, but I didn't give her any prior to that.
So she's not even on a benzo, to your recollection?
To my recollection, I don't remember.
And how much midazolam did he order?
10.
And this is outside this is outside the room, outside where the family is?
Correct.
Okay. How did you take it you were supposed to withdraw that medication from Texas?
To grab it now.
Okay. And to grab it now, how do you have to do it?
Override.
All right. What happens next? Are there any other nurses or other personnel around you as you receive this order?
Yes. Tyler Rudman, who was a nurse on our floor and also a nurse practitioner student, was around, and I had asked him just if this was like a normal palliative dose, because this was my first palliative patient. So.
Tyler, Rudman?
Correct.
When you say there was Tyler Rudman was around, also a nurse practitioner student, are you talking about the same person, or is there another person there who was a nurse practitioner student?
The same person.
Okay. So at the time,
You want a sidebar?
No, the council is inserting facts in its questioning.
Okay,
Tyler
wow,
Rutman was not a student.
okay. Overruled. Do you understand the question?
Yes.
Okay, can you answer it?
I mean,
Would you like him to ask you again?
yeah. Yes.
Tyler Rudman, at the time, what was his role in the ICU, if you know?
So he was a staff nurse in the ICU, but he was going to school to be a nurse practitioner.
Okay, so for those that may not know, like, is that like, is nurse practitioner as far as education, experience, ability, whatever, above being a nurse? Is it like the next step?
Yes, correct.
So he's a nurse, but he's studying to be a nurse practitioner.
Correct.
Okay. The fact that he is a nurse, do you have more experience than you?
Yes.
Did that help you when you asked him this question? You have confidence in his answer?
Yes.
The fact that he is a nurse studying to be a nurse practitioner.
Leading,
You are sustained, rephrase.
Referring to his studying of becoming a nurse practitioner, did that also help you in the confidence in his answer to your inquiry about whether 1,000 was okay?
I don't know if knowing that, but that he was a nurse that had been on the floor, had more experience.
So tell me about your understanding of how nurse Tyler Rudman, right?
Correct.
Who, if anyone, is training him at this time to be a nurse practitioner?
objection, leading, and calls for speculation.
Who, if
Okay.
anyone, is training him? How is that leading?
Okay, let's do sidebar. Ladies and gentlemen,
Judge, I withdraw the question. I withdraw.
no, we're going to do a sidebar. These guys don't have any time with each other, so.
that also was hanging out and offered to kind of help me grab the medication and draw it up. So I also asked him, like, have you ever given this dose? Is this a normal dose of medication? And he said yes, that they had just given one of his patients the same kind of similar doses last week.
Okay. And what was your knowledge, what was your understanding of Earl Huron's experience at this point? How many shifts did you, your 6th shift, you think?
Yes.
And
On my own.
what about Earl Huron? How long had he been there, do you know?
He hadn't been there for too long, but he had PACU experience before coming
What's PACU?
post-anesthesia care unit.
Okay. And he said, and he offers to help you draw this up.
Correct.
What's involved physically with the act of drawing this up?
So getting the medication and in a syringe and drawing the medication from the vial into a syringe.
Okay. Do you remember the size of the unit dose that fentanyl was dispensed in the Pyxis machine back in 2018?
100 micrograms.
And so to get to 1,000, how many unit doses of fentanyl do you need to get?
10.
All right. Showing you what I previously marked for identification purposes. That's State's Exhibit.
It means that it's spinning back there and kind of fix it.
Judge, I think we're a little humor on this issue.
Okay, let's stop. Do we need to discuss it again?
No, it's up to you.
I don't know what he's exactly doing yet.
He's gonna do the little thing with the vials again.
Okay, you're assuming. We will see. He was quasi-objecting, anticipating what you were going to do.
Yeah, well, this is what I'm going to do. I'm going to show her this, Judge, if I can.
Yeah, that's fine.
All right. State's
Properly
Exhibit
mark it.
28B, previously marked and identified, has a unit dose of fentanyl, 100 micrograms. Does that look like what you pulled out of there?
Yeah, yes.
And so when Earl Huron offers to help you prepare this, why do you need help?
There were several vials. He also just kind of offered, and this, like I said, was my first palliative patient, so I felt comfortable having like another nurse with me.
All right. Several vials, 10 of these, right?
Correct.
So do you have like a little tub you put them in? How do you get these all at once? You put them in your pocket? What do you do?
I don't remember. I don't remember getting a tub or anything, just carrying them. So I don't remember if I put them in my pocket. I know Earl helped bring them.
Well, because you also got to get midazolam out, right?
Correct.
10 milligrams of that.
Correct.
Do you recall the unit dose that was dispensed in the fentanyl machine for midazolam?
I don't.
Was it 10 milligrams?
You're talking about the Pyxis machine?
What did I say?
Fentanyl machine?
Oh, the Pyxis machine, sorry, Judge, yes. Do you recall the unit dose for midazolam in the Pyxis machine?
I do not.
All right. Did Earl help you to prepare that dose as well?
Yes.
All right. So they're in these little, what is that, vial? Call that a vial or ampules? Is ampule the word or vial?
Vial.
Vial. They're in these little vials. You got 10 of those, and you don't recall how many midazolams you needed?
I don't recall.
All right. So how do you prepare this to give to the patient?
You draw it up into a syringe.
Do you recall the size of syringe you would have needed for 10 unit doses or 1,000 micrograms of fentanyl?
I don't recall exactly which size that I used.
All right. Do you recall the size of syringe you would have had to use for 10 milligrams of midazolam?
I don't.
Okay. Where are you doing this?
In like another room.
Why are you doing it in another room?
When I got the order, Dr. Husel told me to draw it up in a different room.
Do you know why Dr. Husel told you to draw it up in a different room?
Just for like comfort of the family.
Can you explain that, please?
Just,
Objection, calls for speculation.
Agreed, sustained.
What was your understanding of why he told you to draw it up in another room for the comfort of the family?
Objection.
I'll permit it. Do you have an understanding?
I mean, just to, there was multiple vials, so.
You know what?
There were multiple vials, so just for comfort of the family.
Your understanding, why would that make a family uncomfortable with multiple vials?
Objection, calls for speculation.
I asked for her understanding.
I
Doesn't matter.
understand.
Speculation.
Overruled, I'll permit the question.
I don't know.
Okay, next answer. Next question, I mean. That's my one faux pas of the day.
We all get one, Judge. Was Earl with you when you're in the other room prepping these vials and putting them in syringes?
Yes.
What happens next?
He drew up one of the medications, I don't remember which, and I drew up the other, and then I took them into the patient's room.
What happened next?
I scanned the medication and gave it to the patient.
In what manner did you give it to the patient?
We're
I don't-
lawyers and lay people. But he just wants to know, what did you use to do this?
So the patient's peripheral IV,
All right.
Say that again.
the patient's peripheral IV, like an IV
Okay.
in the arm or wherever it was.
Sherry had a needle in one of her peripheral veins, and you put it into that tube?
Correct.
All right. And did you do it, and what was Dr. Husel's orders regarding the rate at which it should be given? Was this a continuous infusion, for instance, or was it something else?
IV push,
And so what does that mean based on your training and experience?
like having it in that syringe and pushing it through the IV.
All at once?
Yes.
What happens next?
So after I gave the medication and signed it off, I was in the room for a few minutes with the family. The patient did look more comfortable, like her breathing like slowed because she was labor breathing. She looked a little more like relaxed. And then I went out into the nurse's station to chart.
What did you chart? Are you charting about Sandra or just catching up? What are you doing there?
Like catching up on some of my charting.
Okay. We've heard about this back charting. Can you explain what that is?
Like charting, so say you did something and you didn't get it charted at that point, charting it whenever you get a chance to sit on the computer.
And is that a regular practice of nurses and doctors, et cetera?
Yes.
All right. So when you're putting in times for these back charts, are those precise or are those estimates when things occur?
Both.
Okay, fair enough. So what's the next thing you're ever having? You're back, you're catching up on charting at the nurse's station. How far away are you from Miss Castle's room and where the family is?
Not very far.
Is there a monitor that she's hooked up to that you can observe while you're doing your charting?
Yes, she was still hooked up to the monitor. It was just turned off in the patient's room, but we could see it out in the nurse's station.
What's the next thing you remember?
Are you guys hearing her okay? A little volume?
I'm going to step back and be abnormally loud again.
I don't recall what I noticed on the monitor, but I noticed that she may have passed, so I went into the room to look at the patient and called Dr. Husel to come to the bedside.
What happened next?
Dr. Husel came to the bedside, assessed the patient, and pronounced her dead.
What happened next?
I don't recall everything that happened next, but there were you do post-mortem care and cleaning up the patient and taking out IVs and then
Usual things happen.
yes, and then sending the patient
And that's all right?
to the morgue. Then bringing the patient to the morgue.
All right.
Did you get all that? Okay.
All right. And that concludes your care that night on Sandra Castle.
Correct.
Let's talk about the charting that you were talking about, you're catching up on, but did you do any charting with Miss Castle?
I don't recall who all I charted for on that.
Do you recall seeing
In that
portions of
break.
her?
I coughed, it's okay.
Okay. Do you recall seeing portions of her medical records previous to your testimony today?
Portions, yes.
All right. Do you recall, did that have your name on them?
Yes.
Did those records appear to be fair and accurate?
Yes. I mean, so since it was my first palliative patient, I was trying to figure out what I needed to chart and where I needed to chart things, because I was never taught what I needed to chart in this kind of situation.
And I appreciate the precision of your answer, meaning you might not have put everything in there accurately when you reviewed it.
Objection, Judge.
I agree, sustained.
Did these appear to be the medical records of Sandra Castle?
Yes.
All right. When you shook your head and said, yes, but, what did you mean?
I don't know.
Well, that's the answer we've got on record.
All right, we'll go over. I'm going to show you 12C. For the record, it's a binder clipped package of papers. Do you recognize those papers?
Yes.
Do you see your name indicated on those papers?
Yes.
And do they appear to be on the medical records of Sandra Castle?
Yes.
All right. First of all, how old do you remember Miss Castle being? If I could have this back, please.
I believe she was about 80 or in her 80s.
Do you know when she came into the hospital?
I don't remember.
Did you do any prior care with Miss Castle prior to the evening of November 13, 2018?
No.
All right. Showing you the first page of 12C, if I may publish, Your Honor.
May?
Here we see your name down here. That's you, right? Lachard RN Stephanie
Correct.
on 11/13/2018.
Correct.
And 20-08, that'd be about 8:08 p.m.?
Yes.
So this is the evening of we just talked about what happened that evening, right?
Yes.
Okay, what does this action up here say you did on this?
This is just reviewing orders that were put in by various people. If previous nurses didn't review orders, there would be a whole list of orders to review.
Okay, so this indicates that you reviewed the previous nurse's orders?
Whoever put these orders in, yes.
Okay. Going to the second page of 12C, do we see your name here again?
Yes.
And up here we see order details. What is this talking about here?
That would have been when they were extubating the patient. It was normal. It was protocol to black out the monitors in the patient's room if the family members were present, just for their comfort, so it wasn't beeping, but it would still show up at the nurse's station on a computer.
All right.
Going to the third page, do we see your name down here on 11/13 at 15:46?
Yes.
All right, but you weren't at work yet, right?
No, so that's just saying at the 20:08 that I reviewed that order.
Okay, and what is that order that you specifically reviewed?
DNRCC.
So you knew that was her status as far as code?
Correct.
Going to the, where are you on this, Ms. Lashard? Just a moment, Your Honor, here, please. You described the discomfort that Ms. Castle was in. Did you talk about, you referred to the secretions in her throat?
She was gargling.
Is there medicine for that?
Yes, and we did give her that medication. It was glycopuricide.
Okay. Referring to next page in State's Exhibit 12C, do we see an order for that medication?
Yes.
And who was that order given by?
It was given by me.
Okay. Who was it ordered by? I'm sorry.
Oh, Dr. Husel.
And so you did give her that. That's you, meaning you gave it actually after Dr. Husel told you to, right?
Yes.
All right. And then looking at the next page on the 12C entitled Orders, Medication Orders. What is this? What are we looking at here on this page? And there's a laser pointer there if you need to use it to help your testimony.
The fentanyl order, and then the Versed order, the 1,000 of fentanyl and the 10 of Versed, and that they were given by me.
So this indicates who was the doctor that ordered this?
Dr. Husel, yeah.
And at what time did he order this?
2257.
And what time did Dr. Husel order the midazolam / Versed?
The same time.
Okay. And does this indicate who entered and electronically signed this order?
Yes,
And who is that?
that was me.
All right. Can you tell the ladies and gentlemen of the jury what direct charting flow sheets are?
I'm not sure. What?
Did you review any direct charting flow sheets in the medical records of Sandra Castle?
Say that again?
Prior to your testimony today, did you review any medical documents entitled Direct Charting Flow Sheet for Sandra Castle?
I did see some, yes.
All right. But you just don't know exactly what they are?
Title, yeah.
Okay, very good. Refer to the direct charting flow sheet halfway down entitled Pain Intensity Scale. Who does this appear to be for?
Sandra Castle.
And does this appear to be pain intensity scale as documented by various nurses?
Yes.
And what date does that appear to begin on?
This is pain, I feel reassessment? I don't know. But 11/10.
11/10?
Yes.
And is that consistent with the date she was admitted?
Yes.
All right. And do we see your name on this first page that ends on 11/11/2018? Down here?
In this section, no.
All right. Continuing on with the direct charting flow sheet pain intensity scale, do we see your name on this sheet anywhere?
Yes,
All right. And where do we see your name here?
at the bottom.
Okay.
I'm sorry. I didn't hear your answer.
At the bottom,
All right. And what date does that begin on?
the 13th,
All right. And at what time does that begin on?
7:18 at night.
All right. And is that consistent when you took over the care of Ms. Castle?
Yes.
All right. And we don't have an answer to this. What's going on here? Why is there just a dash here?
I'd need to see like the top heading. I think that's just a pain
Is pain level acceptable?
that I just may not have charted that.
Okay. Do we see, continuing on with the direct chart flow sheeting, do we see your name here on the eye-opening response Glasgow? Do you know what that is?
Yes.
And what is that?
So that is like a kind of testing like neurological, how comatose the patient is, if they are.
And we see your name here at the last on 11/13 at 7:44.
Yes.
And what was her eye-opening response Glasgow?
No response.
Okay. What, if anything, based on your training and experience, does that indicate regarding your patient's Glasgow score?
The patient wasn't like specifically responding to pain by opening their eyes.
Okay. The next section is entitled motor response, correct?
Correct.
And is this part of the Glasgow scoring as well?
Yes.
And do we see your name on this page that we were just referring to anywhere?
No.
Moving on to the next page, do we see your name anywhere here?
Yes.
And where do we see your name?
At the bottom.
On 11/13 at 1944?
Correct.
And what was her response, what was her motor response on the Glasgow scale?
No response.
So, going on to her scoring, what score did you give her?
I think that a low score, so
Is that your score?
yes.
And what score did you give her for the record?
3.
And do you know how low the Glasgow score goes?
I believe 3.
Okay. Moving on in the direct flow charting, we have respiratory findings, correct?
Correct.
Are you familiar with this charting?
Yes.
All right. And going through this, do we see your name anywhere on this document?
Yes.
All right. And what do you note on 11/13/2013?
Labored breathing.
That she had labored breathing. Okay. Going on, are you familiar with level of consciousness, -CAM?
Yes.
Do you know what that is?
Just like, are they conscious? Are they responding to you? Are they,
Got to speak up, she can't hear.
sorry, are they conscious? Are they like responding?
Okay. And on 11/13, do we see your rating her level of consciousness?
Yes.
And what was her level of consciousness based on her CAM score?
Comatose.
All right. Going through the direct flow charting, is the next section orientation CAM?
Yes.
And are you familiar with what that is?
Yeah. Yes.
Moving on to the next page, do we see your name anywhere on this?
Yes.
And what did you, I'm sorry. This first part is orientation. Did you chart her orientation on the CAM score?
I don't see it unless it's at the bottom of this paper.
Oh, I'm
No.
sorry.
No, unless it's on the top of the other one, but
Well, moving on to the next page, we have the cognitive CAM. Is this a different charting?
I believe so.
What was her cognitive abilities on 11/13 at 1944?
Difficult to arouse.
The next section, behavior, mood, effect on the CAM score. Do we see your name on this page?
No.
What is her rating all the way down there, though?
Calm.
Moving on to the next page. What does her behavior, mood, affect continue to be?
Calm,
What did you rate her behavior, mood, and affect as?
calm.
Moving on in the direct flow charting, the arm bilateral neuro exam, what is that about?
I don't remember exactly tests, like what you do with this, but it was, I guess, just looking at they're moving their arms or having any movement.
Okay, and what did you rate Miss Castle's arm bilateral neuro exam at?
Flaccid,
And what does that indicate?
that she's not like moving her arms.
Is that consistent with being rigid?
No, but I mean, when I saw her, she was like very rigid, so.
Okay, so was this earlier than when you're talking about then?
The first, yes.
Okay. And moving on, that might actually just be a duplicate. I printed it out twice. This is the same page. That was her arm neuro exam. Did you do the same thing with her leg bilateral exam?
Yes,
And what did you rank her movement as?
the same, flaccid.
Flaccid. Respiratory activity. Direct flow charting. What did you rate her respiratory activity at?
I mean, she was just at rest because she was laying in bed.
Okay. What did you rate her sputum? I'm sorry, pronounce that word for me. Sputum?
Sputum,
Sputum, thank you. And what's sputum?
like secretions, saliva.
That thing we're talking about,
Like
the stuff in your throat?
yeah.
Okay. What did you rank her sputum at? Oh, I'm sorry, you're not even on there.
I did not, yeah.
Sputum consistency, I guess you did, down here at the bottom.
Loose.
Here we have direct flow charting for support people. Do you guys chart how the family is dealing with everything in general?
I did, yes.
All right, and how is the family, according to your notes, dealing with everything at 1944?
Coping appropriately.
I'd like to talk about the medication administration record. What is that?
That's like where you find out if you have any medications due, what medications are ordered for a patient, whether they're as needed or scheduled.
Okay. Is that commonly abbreviated MAR or MAR?
Yes.
And does that indicate that the medications were actually given?
Now I'm used to it. We switched computer systems, but yeah, it would show if it was due or if it was given.
Okay. So referring to the MAR at 1903 on 11/13. This is for Sandra Castle. Referring to, this is the medication administration record.
Yes.
Is that right?
Yes, correct.
At 19:03, so that's what time in real?
That was like 7:03 p.m.
Okay, that's right when you're getting on to work?
Correct.
All right. What was your patient, Sandra Castle, given by the nurse handing her off?
She gave her 10 milligrams IV push of morphine
Okay. And for what would that have been for?
for pain.
Okay. Is there a corresponding note? Should be a corresponding. Okay. 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 And where is that in there? That's just in the monitors. You want me to go through the monitors, right? Okay. All right, this is the one next? No, this is not what I need right now. Sorry, Judge. This is it, right?
Okay.
Okay, thank you. And then at 19:18, so that was 15 minutes before the day shift nurse gave her the morphine, right?
Correct.
And then what happens at 19:18? So this would have been 15 minutes later?
Yes.
All right. And what happened? What was she given next?
So this looks like it's just like a pain reassessment.
Okay. Did you give her this morphine?
No, it's I believe that this was just a pain reassessment. It says pain relieved with medication, no.
Okay, so at 19:33, what happens?
Then I gave another 10 milligrams of morphine.
All right, so this is from the day shift, the every 15 minutes, correct?
Correct.
And then at 19:33, based on your assessment, at 19:18, she's given, per the order from the day shift, another 10 milligrams of morphine, correct?
Correct.
By IV push,
Correct.
and that's you, correct?
Correct.
And where is this? So this is... All right, so what are we looking at here in this form, pain assessment?
Identify for the record.
For the record, it's another page from State's Exhibit 12C, excuse me, titled Pain Assessment for Sandra Castle.
These are pain responses.
Okay, and is this one at the bottom yours?
Yes.
All right, so you assessed her pain at 1918, at 1933, you gave her a shot of morphine, and at 1948, what did you note in the record?
That pain was relieved with medication.
Okay, with that 10 milligrams of morphine?
Correct.
All right. And other symptoms relieved with medication, what was your answer?
Yes.
And what is this, POSS?
That's how like sedated the patient is.
All right. And what does this language over here mean?
So in this case, somnolent, like she
Yeah,
wasn't.
your voice is going
Sorry.
down as you focus.
She
Raise it
wasn't
up.
like responding to like stimulation or
Okay.
verbal, physical stimulation, so not talking.
And this is after you had given her the 10 milligrams of morphine?
Correct.
All right. So at this point, the 10 milligrams is still working, correct? In your mind and based on your charting here?
Based on my charting, yes.
What's it? When was isn't this the one she just gave her? Okay, so we just left off there at 1948, right? Pain relieved with medication, yes, correct? All of this stuff we just saw in your note?
Correct.
Somnolent? No response to verbal or physical stimulation, correct?
Correct.
All right. Is this stuff up here, what's this here at 2100?
That was a medication that they used to wash off a patient's mouth, clean it when they were intubated.
Okay, so that's nothing to do with pain medication, right?
Correct.
What's lorazepam?
It's Ativan. It's another benzo.
Yeah, speak up. It's another what?
Another benzodiazepine.
Stop for a second. It's human nature when you concentrate to lower your voice because you're concentrating. Okay, when you do that, we kind of lose you. Okay, so remember that. Talk out loud so we can hear what you're saying. I realize you're concentrating, but you got to help us.
Okay.
Okay? Because I was losing her. Were you guys losing her? See? And everybody does it. Don't worry, you're not anything special here. Okay?
Okay.
We good, Judge?
Yeah, I was just going through the usual. When people focus on the screen, they tend to be quieter.
All right. Lorazepam, Ativan, I'll try to speak up. You said that was a what?
I believe another benzodiazepine.
What's the first benzodiazepine we talked about today?
Versed.
Versed? Okay. So she does get a benzodiazepine per this day shift order for pain and anxiety, correct?
Correct.
And how much did you give her at this time? 2141?
2 milligrams.
Okay. And did that have, and that was for?
Pain, discomfort.
Okay. And what's the next thing you give her? At 2221.
More morphine.
And how much did you give her?
10.
And this was by a push?
Correct.
And her pain score at that time was?
A 9.
Okay. So how long had it been between this morphine shot and the previous morphine shot?
If there was not any in between, I don't know if I had given any in between.
Show me the first one, 1948. Was that the last shot before the second one here?
That's on the records that you're showing me, yes.
Okay, so between 1948 and 2221, that would be how long?
2.5 hours.
And these medications, are they on a schedule or are they PRN?
PRN,
And that means, again,
as needed.
all right. And then what's this last medication here for?
That's to manage secretions.
Okay. All right. Referring to the next page in the medical administration records, what do you give her at 2236?
I believe that's another pain reassessment.
Okay. Pain relief with medication, what was the answer?
No.
All right. What is her sedation level?
Still the same, the somnolent.
All right. And are you the one doing this pain reassessment?
Yes.
All right. And is that thereafter when she's given 1,000 micrograms of fentanyl?
Correct.
Is that right? Do we have volume now? Okay. And not given Ativan, but midazolam.
Correct.
And how much?
10 milligrams.
Okay. So from those records, does it appear she was getting morphine every 15 minutes throughout your shift?
Not the records, yeah. Not based on those records that I just saw.
Okay. There were, how long of a gap between, I counted 3 times you had to give her morphine that shift?
2.5 hours.
What, if anything, happened regarding your employment and your licensure as a result of your treatment of Miss Sandra Castle?
Objection.
I'll permit it.
So I did receive a notice from the nursing board that cited me. I had a hearing, and I had a 6-month stayed suspension, which meant I could still work as a nurse, but I had to take some extra classes and have quarterly reporting for my employer.
All right. And was that as a result of the shot of it?
Objection.
Okay, speculation agreed, sustained.
What was that a result of?
Objection.
Sustained.
Why were you called to the nursing board?
For
You're not objecting.
Let's go sidebar. It's been a while. Or better yet, we're coming up to a break. Should we take a break?
Judge, I think I'm almost done.
I got people wanting a break over here. Let's take 15 minutes.
All rise.
We'll see you guys in 15 minutes. Remember the admonition.
nursing board after November of 2018?
Yes, I received a notice of opportunity for hearing.
All right. Regarding your employment, was your employment with Mount Carmel affected in any way after November of 2018?
I was placed on administrative leave in December of 2018
How long did that administrative leave last?
until July of 2019.
What, if anything, happened after July of 2019?
I was brought back on staff.
All right. Did you go back to Mount Carmel West in the ICU?
No, I took a job at Mount Carmel St. Anne's.
In the ICU?
No,
Where do you work now?
I work in maternity.
Okay. And that's where you presently work still?
That's where I presently work.
All right. And looking back on the medical records, do you recall if Ms. Castle had just been extubated prior to your arriving to work at around 7 o'clock that night?
I believe she was extubated sometime in the 3 to 4 o'clock hour.
All right. Why is she still, if you know, why is she still in the ICU at 7 o'clock? What would normally happen to somebody extubated that's alive several hours later?
They would normally, I guess, be transferred to the palliative floor, but there were arrangements during the previous shift to keep the patient in the ICU because that patient had a lot of family, and just for the comfort of the family, it was my understanding they had decided to keep the patient on the floor.
So she's receiving palliative care in the ICU during her shift, basically.
Correct.
And was that your understanding of the normal course of things?
At that moment, I don't know that I knew the normal course of things.
And how many shifts did you work prior to this on your own?
6.
Thank you. I have no further questions.
Mr. Bias?
Okay. This is just a duplicate. This is what I showed. It was the same thing. This is your deposition.
No, where's the records?
Right here. And I just went through them so that like this. I just flipped them over. So it should be good if you start at the beginning. Back here, that should be the first page. Sorry, I didn't get back to it.
Please record. Mr. Zion. Good afternoon, ladies and gentlemen. Good afternoon, Mrs. Short.
Good afternoon.
Okay, I'm going to ask you a few questions. I'm going to try and go chronologically, if that's okay.
Yes.
Okay. First off, you were asked about overrides, and then you compared it to, I guess, your question about comparing it to your prior job at the Cleveland Clinic. You remember that question?
Yes.
You didn't work in the ICU at the Cleveland Clinic, though, right?
I did not.
So, fair to say, in an ICU, things are happening a little more rapidly, correct?
Correct.
Okay. And patients are far more in critical condition than they were in, I think you worked in the transplant?
Correct.
So, very big difference in the number of emergency situations that would require an override, right?
Correct.
Okay. So I just wanted to clear that part up. Now let's talk about when you first got on staff, when you first came to work that day. Okay. Now, when you first got there, you said you got briefed from the prior nurse as to Miss Castle's condition, right?
Correct.
And you learned that she had been palliative, extubated, and her family wanted to withdraw care, correct?
Correct.
And that is because life support was going to be withdrawn, and basically she would have moments to minutes to hours left to live, correct?
Correct.
So the last, and you said there were a lot of family members there when you got there?
There was.
Okay. And this was basically the family's last opportunity to say goodbye to Miss Castle, correct?
My understanding when a lot of the family left is that they were saying goodbye for the last time.
Okay. And over the course, you said she was extubated around 3 or 4 p.m. that afternoon, right?
Correct.
And when you look at the MAR, I guess you were also briefed on what kind of medication she was on and so on, right?
I don't recall like specifics. I do just remember that she had mentioned the 10 milligrams of morphine.
Okay. So it was your understanding, too, that she had been given several pain meds beforehand, right?
Correct.
And none of it was working, right?
Correct.
Okay. So this family, this large group of family, was seeing Miss Castle going through some pain and suffering. Is that fair to say?
Yes.
And their last memories of Miss Castle would be those before they said goodbye.
Correct.
And when you gave the 10 milligrams of morphine, you gave it to her to alleviate her pain, right?
Correct.
And that was your intent and purpose?
Correct.
And when you first got there, I guess I'm going to show you Joint Exhibit 12, page 812 through 813. Do you see that there?
Yes.
Okay. Do you recall going over this with the prosecutor?
Yes.
Okay. And he asked you specifically about this entry here, where the pain, on 1948, the pain was relieved by medication, and you wrote, and you checked yes. Do you see that?
Yes.
Okay. He didn't show you the next page. Do you recall seeing the next page of this document?
No.
Okay. On the next page on this document, at 2236, it asked pain relief with medication, and you indicated no. Do you see that?
Yes.
Okay. Now, I would like for you to take us to the ICU on that evening. You described under direct examination that Miss Castle was gurgling. Do you recall that?
Yes.
Okay. And this is from fluid in the lungs, from what you recall?
Yes.
And you found it disturbing?
It was, I mean, you could hear it throughout, like, down the hall in the ICU. Other nurses had commented on it as well.
Okay, so you, at this point, you know you believe she's in pain, right?
Correct.
And you're hearing her gurgling to the point where you can hear it all the way in the other end of the ICU.
Tell her to be patient.
Correct.
And it's so bad that other nurses are telling you about it.
Correct.
And
Mr.
the
Baez,
family is still present.
sorry to interrupt you. We have a 3 o'clock Zoom scheduled. Are we going to hold them off?
Your Honor, I texted and emailed and told him that it would be closer to 4.
Okay.
If we could just
I just have the media people saying, we got ready to put this up, but they can all see it for. Sorry to interrupt you there, but
It's okay, Judge, I understand.
scheduling is like herding cats.
Mr. Short, I want you to take us back to the ICU one night. Ms. Castle is gurgling loudly, right?
Correct.
And you could hear it throughout the ICU.
Correct.
And she's also moaning,
Correct.
and you had mentioned that you could see a tear dropping down the side of her face, correct?
Correct.
And you also testified under direct that when you observed her, she was also grimacing in pain,
Correct.
and that her family was there to share her last moments of life with her, correct?
Correct.
And at approximately $21.41, I'm sorry, I want to make sure I get the right time. I'm sorry, approximately 22:26, and I'm showing you Joint Exhibit 896, I'm sorry, Joint Exhibit 12, page 896 to 900. At this point, Dr. Husel orders, can you pronounce that for us?
Glycopyrrolate.
Okay. And that is to potentially address the loud gurgling that she is going throughout where everyone can hear it throughout the ICU, right?
Correct.
So this is the first time that you reached out to Dr. Husel to get some type of medication, correct?
Correct.
And you properly advised him of what your patient was going through, right?
Correct. Yes.
At this time, Dr. Husel didn't come over and order any fentanyl, correct?
Correct.
That was not his first choice of medication. It was, in fact, this one, correct?
Correct.
And subsequent to this, ma'am, Miss Castle continued to suffer, did she not?
She still looked like she was in pain, yeah. Severe pain.
And while Miss Castle was going through this pain, you were approached by the family, were you not?
Correct, yeah.
Okay. You didn't testify about that during direct, did you? About the family coming to you to ask you for more pain meds?
I don't believe so.
Okay. And the family comes to you, and it is now, everyone had already said their goodbyes, correct?
Correct.
And before I go any further, there was one record that I don't think you reviewed under direct as well, and that is Joint Exhibit 12, page 486. And I want to reference the time. I want you to look at the time where your name is mentioned here. 7:44 is shortly when you got there, correct? After you had gotten there, about an hour? Does that sound right?
Yes.
Okay. And her pulse oximetry is at 90, is it not?
Yes.
Tell the ladies and gentlemen of the jury what pulse oximetry is.
It's a reading of like the oxygen in the blood.
Okay. And that's important to sustain life, right?
Correct.
Okay. And at this time, when you shortly arrived, she's at 90, and the range is 90 to 100, correct? That's the optimal range?
Correct.
Okay. And then right around the time where she is suffering and gurgling. Have you heard the term death rattle before?
Yes.
Okay. Would that accurately describe what you heard?
Yes.
Okay. And does it sound like boiling water or something like that? Or like someone's drowning?
It sounds like a drowning.
It sounds like a person's drowning.
Yes.
And you could hear it throughout the ICU.
Yes.
And as you're hearing this, you see her, which is around 10 p.m., 2200, before that medication was ordered. Again, I apologize for not being able to pronounce it right. That was ordered 26 minutes later, right?
Correct.
Okay. But at this time, her pulse oximetry is at 66. Do you see that?
Yes.
That's dangerously low, is it not, based on your training and experience?
Yes.
So she's actively dying at this point.
Her pulse ox is dropping, yes.
Her pulse is dropping.
Yes. The oxygen level?
And yes. And then the family approaches you and asks you for more pain meds because they don't want to see her suffering anymore.
Yes, so like I was in the room and we were talking and they thought she looked more uncomfortable and wanted more pain medicine.
And it's at this time that you went out and got Dr. Husel to come to the bedside.
Correct.
And when Dr. Husel came, he spoke with the family
Yes.
and he assessed the patient.
Yes.
And after speaking to the family and assessing the patient, he then informed the family.
Objection, Your Honor.
Sustained.
There was a time, there was a decision that needed to be made by the family, correct? To get these pain meds?
Correct.
And tell the ladies and gentlemen of the jury how that decision went about. How did the family go about making that decision?
Objection has to hearsay, Your Honor.
Sustained.
Ms. Lachard, in order for, well, let me pose it this way so I can best pose it this way. There was a decision that the family had to make, correct?
Correct.
Okay. And as part of the decision, this was Dr. Husel had to give the family all of the facts.
Correct.
Okay. And that included the information of potential side effects of the medication, correct?
Sustained.
Did the family become aware through this transaction, through this negotiate, or through this discussion, that there were potential side effects to the medication?
Sustained.
In your training and experience, based on your training and experience, did the family receive all of the information that they needed to make an informed decision?
In that moment, yes.
Okay. And would that have included the potential side effects of the medication?
Sustained.
Can you describe Dr. Husel's demeanor when speaking to the family at this time?
He was kind, patient, caring, and talking to the family.
And was he informative?
Yes.
Was he detailed?
Yes.
Did he leave the decision up to the family, or did he tell them what he was going to do?
He left the decision up to the family if they wanted the patient to get more pain medicine.
And when describing the medication,
Objection, Your Honor.
Sustained.
can I have just a moment, Judge?
Yeah.
Now, after making what you believe was an informed decision, that is when Dr. Husel asked you to, gave you the order of the 1,000 fentanyl and the anti-anxiety medication, correct?
Correct.
And
Just let you know.
before I ask you about these vials, did you think that he was, during the discussion with Dr. Husel and the family, did you, well, let me put it this way. If Dr. Husel had hidden important information about the side effects of the medicine, would you have spoken up and informed the family and given them more information?
Yes.
Okay. And did you have to do that?
No.
Now, in your entire time as a nurse practitioner, I'm sorry, as a nurse, both at the Cleveland Clinic and at Mount Carmel, has a doctor ever told you when ordering medication, get me 1, 2, 3 vials, give the patient 3 vials of medication?
No.
Right. So it's never done by vials, right? It's done by either milligrams or micrograms or whatever metric system they're using. Right?
Correct.
So after the family made this decision, Dr. Husel then asked you to do the syringe in another patient's room, correct?
In an empty room.
In an
Correct.
empty room. I didn't mean in front of another patient. And you understood that to be for the comfort of the family, right?
Correct.
Because I presume they were going through enough at this time. Fair to say?
Fair to say.
Needles, in your experience and training, needles can be quite frightening to people, wouldn't you say?
Yes.
Now, ma'am, after giving the medication, did Ms. Castle continue to suffer?
She looked more comfortable. She didn't look like she was in pain like she had.
You didn't see her you didn't see her displaying any more of the symptoms that she was previously.
Correct.
She started breathing a little normally and not acting,
Correct.
and she wasn't doing the death rattle anymore.
Correct, or at least not as bad.
And you didn't see any more tears fall down the side of her face.
Correct.
And did you feel, was it your decision that at that time you could leave the family alone with her at bedside to spend their last moments?
Correct.
And that was her only son?
I don't know. I think she had more kids because there was a lot of family in the beginning.
So, but that was with her son, and her granddaughter got to be with her in, would you describe it, a peaceful state?
Yes.
And that's when you went over to the monitoring station and you were able to observe her vital signs on the nurse's monitors, correct?
Correct.
And that's attached to a computer, and all of that is working at the same time that the family is spending their last moments with Ms. Castle.
Correct.
And then after that, when you recognized that perhaps Ms. Castle had passed away, you went and got Dr. Husel.
Correct.
And when Dr. Husel came in the room, tell the ladies and gentlemen of the jury what his demeanor was like when he came back in the room to declare her dead.
The same, like, calm, kind, caring.
And those are the words that you would use to describe Dr. Husel during Ms. Castle's care and his interactions with the family. Kind, caring, compassionate?
Yes.
I have a couple of post questions to ask you. And the first one was, when the police had come to speak with you, did you have a lawyer?
No.
Did you think there were lawyers about, is that correct?
There was a lawyer that had read me my rights, like, right before.
Did you think that he was your lawyer?
No.
Did he sit in the interview when you spoke with the detectives?
No.
Did you think that the detectives, did you get the impression that the detectives knew what kind of questions to even ask you?
No. Not.
In fact, you believe that they were kind of learning as they were going along. Is that a fair
Correct.
statement?
That's fair.
And you didn't even know that the police were going to come and question you on that day, correct?
Correct.
That was, they kind of surprised you with this?
Yes.
Did you have an opportunity to make a phone call, to talk to someone or call your husband? Or
Hold on.
Need a lawyer?
Time out, stop. Sidebar.
I'll withdraw the question, Judge.
Okay. You're to disregard the question, ladies and gentlemen.
Now, Mrs. Sharp, when you gave the fentanyl in Versed to Ms. Castle, it was your intent to treat the symptoms that she was having, correct?
Correct.
You didn't have any ill intent to harm her in any way, shape, or form.
No.
And you also understood that the intent was not to hasten her death, but to treat the symptoms and make her comfortable.
Correct. Correct.
Can I have just a moment, Judge?
Yes.
further questions. Thank you, Mr. Chairman.
Mr. Zion?
Actually, I just have one question. Sorry.
Counselor, you sat down.
Sorry, Judge. I
Make
know.
one, because every
Yes.
time you say one question, it's 5.
Sure. All of the things that you told us about her death rattle, her suffering, her what she was going through that evening in the ICU, all the records in the world would never fully describe it, correct?
Correct.
I lied. I really just have to agree more.
Make it quick. We've got time considerations here.
I asked all of these, and you weren't even trained on how to chart in the ICU during a palliative extubation, were you?
No.
You sure?
Yes, sir.
I'm waiting for you to sit down before I bring Mr. Zion up. Mr. Zion, any redirect?
Yes, sir. Remember defense counsel asking you, a decision had to be made by the family. Remember that question?
Yes.
When was she palliatively extubated?
Before my shift, so 3, 4 o'clock in the afternoon.
And is that when she would have been changed to do not resuscitate comfort care?
Yes.
And so at that point, before your shift, the decision had been made to just keep her comfortable throughout the dying process?
Correct.
So that decision had been made hours before.
Objection, Judge.
He just asked to sustain. You just asked her when it occurred. Are you transitioning?
Yes. That decision had been made
Okay.
hours before, right?
Correct.
What decision are you referring to now that needs to be made?
Just if they thought she was looking more uncomfortable and needed more pain medicine.
That's the big decision you're talking about?
Yes.
As part of your training and experience, you are aware, or are you aware, that you cannot
Objection, leading.
I haven't heard the whole question. Go ahead.
Are you aware that as part of your duties as a nurse, you cannot cause someone's death with excessive pain medication?
Objection.
Overruled.
Right.
Correct.
So what's the big decision the family needs to make here?
Objection. Counsel's characterization.
Overruled.
The issue is to receive more pain meds, that was what it was.
Okay, you made your point. Overruled.
State it again.
What's the big decision that needs to be made at 10 o'clock at night now?
Objection, Judge.
I've already ruled.
A big decision. This is strictly argument, and not a...
I've ruled, counsel.
Just that if she needed more medication than what she was receiving, more pain medication.
And how much pain medication was she on up to this point?
10 milligrams of morphine,
And how much pain medication did Dr. Husel order?
1,000 micrograms of fentanyl.
Mr. Defense Counsel asked you, based on your training and experience, did the family have all the information in the decision up to that point? Remember that line?
Yes.
Your training and experience, how many shifts had you worked at this point?
6.
So the context of that
Maybe.
question is in the 6 prior times you had worked in the ICU.
Objection, Judge.
I'll permit it.
Correct in my training and orientation.
But you had no training in palliative care at that point, correct?
Correct.
And this isn't palliative extubation, this is actual palliative care, right?
Yes.
Because she should have been transferred to the palliative floor, right?
Correct.
Objection, Judge. Calls for speculation.
Sustained.
I move to strike.
What was the standard?
Ladies and gentlemen, disregard the question.
You said earlier that she was not transferred to the palliative floor.
Correct.
Is that different than how it should have normally been done?
Objection, Judge. Calls for speculation.
No, I'll let her.
From what was told to me at report, she would have been
Objection.
transferred out.
Speculation.
Okay, so you don't know for yourself?
No, because I was never trained on.
Did you review the note in the medical records that talked about that as part of your preparation today?
Objection. He's asking her at that time, and now he's asking her.
No, he's moved on, but that's okay. Did you review the notes?
There was an order to transfer her out.
After
That
how
was
many
reviewed
hours?
after 4 hours,
And why wasn't that done?
because a decision was made prior to my shift for the comfort of the family to keep them in the ICU.
So you've got this extubated patient still in the ICU, and she's being really loud?
Yes,
You can hear it down the hallway.
yes.
It's disturbing.
I mean, it's hard to hear.
Yeah. And she's not even really an ICU patient, is she?
Objection.
Sustained, asked and answered.
Is she on a ventilator at this point?
No,
Is she being treated with intensive care at this point?
no,
Is she given palliative comfort care at this point?
yes,
Is she still on the ICU floor at this point?
yes,
And is she being very loud, and are the noises she's making hard to hear?
yes,
And a decision had to be made by the family, right?
correct.
That, you recall, the defense counsel characterizing that, that's the conversation Dr. Husel had. A decision had to be made by the family.
Objection, Judge.
Can you answer that?
Correct.
Okay. You testified earlier, Mr. Baez said that all the pain medication earlier had not alleviated her pain. Do you remember that?
I remember talking about those records, yes.
He said none of it was working. Remember that?
Yes,
As part of the medical records on this and part of your handoff care that night, do you recall seeing the pain assessment form from earlier in the shift?
Objection.
I think we're outside the cross, aren't we?
This was the question. He said none of the previous pain medication doses had worked. And she answered yes. And that was her knowledge, that none of it had worked.
Go ahead.
Do you remember reviewing?
Objection, Judge. These are not her records, and she testified she did not review those records.
Noted, overruled.
Do you remember reviewing the earlier pain assessments or during the handoff, talking to the person that had cared for her earlier in the day?
I don't know if we talked about the pain, like assessing her pain.
But this is you right here on 11/13 at 23:57, correct?
Correct.
And this is the previous nurse that was taking care of them, correct?
No,
What about up here?
not the nurse prior to my.
Okay. The two previous pain response form notes, though, by the nurses, those are those two previous notes there, right?
Yes,
Oh, okay, I'm sorry. It's this one here,
Judge.
on 11/13 at 3:44.
Okay, hold on. You got an objection?
Yes. Those entries were before the extubation, Judge.
Okay, that's a matter of fact.
Did you talk to the nurse that handed her off to you?
Yes.
Do you remember him talking about 10 milligrams of morphine?
Her, yes.
For purposes of what happened during your course of treatment, did he tell you whether that was a high dose or not?
She had mentioned that
What
it
did
was a
she
high
say in
dose.
regards to that for purposes of your treatment of this patient?
Repeat it again.
What?
Objection.
Sustained as to the format of the question, rephrase.
For purposes of your treatment of Miss Castle, for purposes of the medical treatment of Miss Castle, what, if anything, did you learn about the 10 milligram dose of morphine that she had been receiving as needed after extubation?
That it was like a higher dose and that she had given her some.
Okay. The defense counsel said you didn't testify on direct about the family coming to you on bedside. Do you recall testifying on direct about talking to the family about her level of discomfort?
Yeah, I don't remember all the
Did you talk to the
questions.
family about her level of discomfort?
Yes.
Right. And
Yes.
did you listen to what they had to say because they know her best?
Yes.
Okay. And Mr. Bias said, or asked you, they didn't want her to suffer anymore. Do you remember that question from the defense counsel?
Yes.
And so a decision needed to be made. Remember that
Objection,
question?
Okay. Slow down. Rephrase.
Do you remember Mr. Baez asking you, in regards to your conversations with the family, they didn't want her to suffer anymore?
Objection, Judge. That wasn't my question.
Okay. Do you understand the question? Do you remember Mr. Bias talking about that issue?
Yes.
All right. And then asking you about a decision needed to be made.
Objection, Judge.
Do you remember him asking you that?
Yes.
Have you ever had Mr. Baez ask you about the vials? Remember the 3 vials? You put them up here. Remember that?
Yes.
You ever have a doctor ask you to give that much fentanyl to anybody besides Dr. Husel?
Objection.
Okay, sustained.
You said the decision that had to be made.
Objection, Judge. Again, this mischaracterization of my questions.
Okay. He hasn't got the question out yet. I don't know.
The decision that had to be made was to whether or not give her more pain medication.
Correct.
Asked and answered.
Okay.
And,
He's going with this somewhere. I'm waiting for him to get there.
thank you, Judge. And she had received 10 milligrams of morphine previous.
Okay, that's been asked and answered.
May I?
Well, I'm waiting for you to get to something that's appropriate.
And how much did he increase that pain medication to?
in his and after that decision had to be made with the family.
Objection.
Sustained.
How much did he increase that medication to?
Objection.
Sustained.
And nothing further.
Anything on the pre-procedure pain scores?
Yes, Judge.
Is it your usual one question?
2 or 3?
Sorry, punching late in the day.
I want, Ms. Lachard, I want to ask you about a document that counsel had just shown you about the pre-medications. This is you at 7:18 p.m. on the 13th, correct?
Correct.
And then you were asked about 0344 on the 13th, correct?
Correct.
And that was earlier the day before? I'm sorry, the same date, but 3 in the morning, correct?
Correct.
And then the other time you were asked was 3 days earlier at 01 in the morning, almost 2 in the morning, correct?
Correct.
And the characterization of having 10 milligrams of morphine, that was
No. Outside of your permission.
okay. Were you aware of the prior medications that she received for pain, that she had received 6,000 micrograms of fentanyl in the 3 days that she was
Sustained,
a patient?
outside the scope.
I have no further questions.
Ladies and gentlemen, disregard the last question. Okay, ma'am, you may step down. Just hang tight for a second. I'm going to send them out for 10 minutes while we put up the screen and get everything situated. Okay? Figured you guys could use a leg stretch. I could. Okay? Remember the admonition? 10 minutes for us to get things set up. Just relax. You stand up while they go out.
Okay.
I'm the one who gets to sit. And I probably shouldn't, but I do. They know I'm respectful of them. I heard you guys got cheesecake today. Oy vey.
a registrar's number of 20180000694.
Well, if you give me a second, okay.
Sorry.
I didn't know where it was. Okay. Yes, I see it.
Okay, and is this a death certificate for Frances Marlene Burke?
That is correct.
And was Frances Burke a patient in your private practice of medicine?
She was, yes.
Okay. Do you remember this lady?
I do very, very vividly, yes.
Okay, thank you. What did you list as her cause of death?
The immediate cause of death was an acute intracranial bleed. In other words, she had bleeding into the brain.
Okay, thank you. And
Okay.
what is the date of her death?
Okay, let me look again here. It looks like January 14th, 2018.
Thank you, sir. And what date did you sign this death certificate?
January 16th, 2018.
Okay, thank you. And did you attend her at her death or demise?
No, I did not.
Okay. Why do you feel that this death certificate was incumbent upon you to execute it?
Well, that's a good question. In my experience, if the emergency room doctor doesn't sign the death certificate, or the attending doctor in the hospital doesn't sign the death certificate, they usually go to the primary care physician to see if there is any, if that physician would know any medical reason why this patient might have passed away.
Okay.
If not, I believe it has to go to the coroner.
Okay. Have you reviewed the medical records relating to her last illness and death prior to yesterday?
I did when I signed the death certificate, yes.
Okay, all right. Thank you, sir. Nothing else.
Ross?
Your Honor, a brief moment to set up technologically.
We're going to take our chances with it when we've been using the overhead?
Wait,
Okay.
Can I use the overhead to share things with
You can
him?
use the overhead. It's been working. I just don't know if it's going to work on the screen where you can see.
That's what we need.
Well, I understand that. Let's try it. Should put a document up there and I'll ask him if he can see it.
Let me see if I could expedite things, Your Honor. Dr. May, good afternoon. I know you have a doctor's appointment. I'm going to try and get you out of here as soon as possible, okay?
That would be fine.
Are you in Florida yet?
Excuse me?
Are you in Florida yet?
No, I'm home. The sun is out here, but I am in Columbus.
Doctor, do you have those medical records that the state emailed you yesterday that you indicated you reviewed prior to doing Ms. Burke's death certificate? Do you have them on hand?
I printed out the death certificate from the email. There was 198 pages of other records I did not print out.
Okay.
And I reviewed maybe the first 4 or 5 pages, and that was it.
Okay, doctor. Let's. We're gonna have to do that, unfortunately.
See if it works.
Let's see. Did you want to try this first?
I guess this is the cord.
Here comes Purdue.
No.
I don't think I have this.
Because mine's still spinning.
Oh, no, this visibility.
Which cord do we have to plug in, Paul?
Oh. I don't have an issue with it.
We used your laptop the last time we did this.
Yeah, but we did it from here specifically.
Okay, so we're gonna have to do it that way.
guess this is the problem with Zoom witnesses.
Okay. Which one do you want me to pull up first?
Page 6.
You can assist. We're sending in the first two. There it goes. It's a start, but it's not up there yet.
Oh,
There we
see it.
go.
All right. Doctor, can you see this medical record?
I can see part of it, yes.
Okay, and just to clarify, this is a medical record for Ms. Burke, correct?
Yes, that is correct.
And it's her discharge summary done by a doctor named Wagner, correct?
Yes.
Okay, now let's scroll down to, okay, right there. Do you see the primary care physician is listed as yourself there, correct?
Correct.
And the active and final diagnosis was compression of the brain, right?
Correct.
And for the hospital course, it says CH&P, correct?
Correct.
Okay, now let's go to page 9, please. For the record, I'm referring to Joint Exhibit 6, pages 6 through 13. Page 9. Okay, perfect. Okay, doctor, do you see here the history and physical that was referenced in the discharge summary?
I see part of it, yes.
Okay. Do you see the portion that lists history of prison illness / brief note?
Yes.
And again, this was done by Dr. Wagner?
That's what it says.
Okay. So, just to clarify, Ms. Burke, per this document, arrived to the hospital with sudden onset right-sided weakness with an altered mental status which progressed to obtubation. Is that accurate based off what Dr. Wagner put in his history and physical?
That's correct.
And she had previously been on Xarelto for pulmonary embolism, correct? Did you get that, Sam? No. Can you repeat your answer? I'm sorry.
That is correct.
Okay. And you know, as her primary care physician, that she had been taking Xarelto for a pulmonary embolism because you had seen her after she had seen you a couple months prior to this for throwing up blood, right?
For what type of blood did you say?
She was having issues where she was vomiting blood a couple months prior to January 14th of 2018, correct?
I don't remember that. We're talking 3 or 4 years ago, and I do not have her chart, but it certainly is possible.
Okay. I want to direct your attention to the sentence that starts with neurosurgery. Do you see that there?
Yes.
Okay. And it indicates here that based off her injury, that neurosurgery was notified, but that no interventions were necessary. That's accurate according to this document, correct?
Correct.
And that the family elected to withdraw care due to the severe findings and worsening neurological exam, correct?
That's correct.
Now, let's go to page 23 real quick. Okay. So, I just want to talk to you real quick about how she first appeared at the hospital. Scroll down to where it says Constitution, please. Right there. This is the emergency urgent care note for Ms. Burke when she arrived at the hospital, correct?
Yes.
And it indicates that she arrived at the hospital with agonal respirations and vomitus coming from the mouth. Is that accurate?
That is accurate.
So she arrived with a brain injury, struggling to breathe, and vomiting from the mouth. Correct?
Correct.
Okay. Let's go to page 10, please. You see here, doctor, this note by a doctor named Closer on January 13th of 2018?
Yes, Douglas Closser, I would say. Yeah, C-L-O-S-S-E-R. Correct.
Okay, doctor. And this is the day prior, or rather hours prior to her dying, correct?
I'm not sure the exact time of her death, but yes.
Okay. You see there the last two sentences of that paragraph where it states that the proposed shutoff and the patient began to decerebrate posturing. Do you see that?
Yeah, decerebrate posturing, correct.
And decerebrate posturing is when someone involuntarily has an abnormal body posture, correct?
Correct?
The arms and legs stick straight out involuntarily, correct? The toes
Correct.
point downward.
Correct?
The head and neck are involuntarily but forcefully forced backwards, correct?
Correct?
The muscles are tight and rigid when this is occurring.
Correct?
So just to bring us up to date, she arrives at the hospital struggling to breathe, vomiting, with a brain injury, and has involuntary posturing forcing her to be in an abnormal position, correct?
Correct?
None of that would be comfortable, right?
I do not know.
Sustained.
Fortunately, it's never happened to me, and most people...
Doc, stop. There was an objection. I sustained it. You don't have to answer the question.
Okay, sorry. I did not hear that, sir.
Well, this is one of the problems with Zoom. Relax. You're good.
Okay.
Scroll down to the bottom for impression and plan. Okay, this is the next page.
You said 9.
11. All right. Okay. This is the next page of that same document, Doctor, just to orient ourselves. Do you see where it says under impression and plan?
Yeah, yes, I do.
And it indicates that her brain injury is devastating, correct?
That's what it says, yes.
And it says that she has evidence that the pressure in her brain is increasing and herniating, right?
Correct.
Could you read the next sentence after that, please?
Sustained.
Does this does it not state?
Again,
Sustained.
I mean, are we just going to read the order?
You're asking, he doesn't have any independent knowledge. You're asking him basically to recite a report that's already into evidence.
Doctor, you were emailed these documents by the state last night, were you not?
Yes, I was.
To prepare for your testimony today, right, Doctor?
I was not asked to read the entire package of papers, no.
But you were here to testify as to what you put down as her cause of death, right?
Right, but I did not have these records when I signed the death certificate.
Okay. So that when you signed this death certificate, you were unaware that other doctors had indicated that her brain injury would be fatal even with the most aggressive of care.
That's possible. I may have known that. I can't tell you that. That was about 4 years ago.
Okay, Doctor, based off what you did review in the medical records prior to signing your death certificate, you had no reason to believe that anything but this head injury that resulted in her struggling to breathe, having pressure growing in her brain, forcing herself into involuntary abnormal posturing in front of her family, you wouldn't have any reason to believe that anything else caused her death but that condition, correct?
You're asking for an opinion. You're giving a hypothetical circumstances, and you're as to another doctor's care. No.
I'm simply asking you.
No.
Did you have any reason to believe that this condition did not result in her death?
Same.
Sustained.
In your experience, with someone with this type of brain injury, with these types of symptoms, that would be fatal, correct?
Sustained.
Nothing further.
Redirect.
Nothing further, Your Honor.
Okay, doctor, thank you for your time. Good luck with your doctor's appointment. Be safe.
You're welcome. Thank you.
Take us down, Paul. Have a good day. Hang up. Hey, I'm getting used to it. Ms. Grubb, call your next witness.
Your Honor, we're out of witnesses for the day.
Do we sit and stare at each other for the next hour? No? You want to go home? We had a good day, so we got through a lot of stuff. So, ladies and gentlemen, we'll get started at 9 in the morning. It's my understanding we're bringing back Dr. Ely.
That's correct, Your Honor.
Okay, so the doctor's coming back in to finish up his testimony. If you remember, he had a family issue. So with that, have a great evening. Remember the admonitions. Be safe. David.
All rise.
I'll get him trained. He's only been with me 10-something years. Have a good evening, guys.
Thank you.
Yeah, that choked out.
Okay. Ms. Grubb, anything for the record?
Judge, I think we just want to warn everybody that we set aside the whole day for Dr. Ely, wanting to make sure he got done, and with the knowledge that we were breaking a little early tomorrow. Now, Ms. Menashe said that she might not spend all that much time on cross, so we've been scrambling to get other witnesses here, Judge, but no one's stepped up yet. So we want to give everyone a heads up. That's all we have now. If we find someone that's able to come in tomorrow, we're even going into like the family members and stuff, but so far we haven't been able to find anyone that can clear their schedule on such short notice. So we might be breaking very early tomorrow, depending on how things
We
go.
can't afford too much more of this.
Judge, we're going to
getting
ramp it way
behind
up here. We ramped it way back because we had the issue of people out in the hall for 2 days at a time. So we're going to try to ramp it that big time next week. So we won't.
Okay.
I hope we don't run into this again.
Mr. Lapita, you're on the floor. Anything further?
There you are.
Okay. Have a good evening.
Thank you, Judge.
Thank you, Your Honor.